Hi students, my name is Jamie Van Beek and welcome to my course. I am very excited to be your teacher this quarter at Whatcom Community College. The purpose of this video is to really explain who I am and what it's like to be a student in one of my classes. I have been a healthcare provider for over 20 years and I have a number of certifications and licenses and degrees. I have been a firefighter, emergency medical technician. I have been a phlebotomist. I have been an autopsy assistant. I am a medical assistant. I have been a physical therapist assistant for 15 years, and I have worked in acute care, subacute care, chronic, and outpatient as well. And I'm also a certified Red Cross CPR and first aid instructor. It's coming up on 10 years I've been teaching at Whatcom Community College, and I absolutely love teaching. It is such an honor for me to be able to work with students, knowing that students are going to be able to touch and heal and make a difference in patients' lives when they get done with our programs. That's what really inspires me, is not only working with students, but also thinking about the patients that you're going to make a difference with when you're finished with school. As an instructor, I'm creative, I'm organized, I care tremendously about my students, and I'm excited. I'm always excited to try something new in the classroom. I am a risk taker, and that makes learning fun. And if I'm having fun, you guys are having fun, learning is happening in the classroom. To me, teaching means making learning happen, and it's not just putting out information. There is so much research out there that states that students learn through practice and feedback, not by a teacher standing up in front of them and telling them what they're supposed to know and not know. The students have to be absorbed in their own learning. They have to find some value in it for themselves in order to want to invest in the education. So I strive in my classrooms to do that. The first thing you won't see in one of my classrooms is me droning over and over for hours and hours on a PowerPoint. You can see here in this picture that I'm using a PowerPoint, and yes, I do use PowerPoints in my face-to-face classes, but I'm using them as a teaching tool. It's not a PowerPoint show where I'm reading a PowerPoint to you as you're reading it on the screen. I like to mix things up. Research shows that nonstop lecturing actually produces very little learning. But good instructors who never lectured could never motivate students by occasionally sharing our experiences and our wisdom about the subject, about the patients, about the content that we're talking about. So I like to mix things up. I may do board work. I may be at the board. I may have students come up to the board and we're writing the content and learning the content. I will use props such as you see in this video. I'm explaining about a cell body, and I'm using those to represent the myelin sheath and how a nerve impulse is transmitted. I like to create significant learning activities as well. In this video you are seeing my PTA students, physical therapy assistant students, had to learn how to do transfers, how to help people in and out of a wheelchair, on and off a bed, who've had a stroke, who've had a spinal cord injury. They had to learn this content, they had to make brochures about their content, and then they had to teach this to the RN students how to do transfers. So not only are they learning the content, they're practicing the content, and then they're teaching it to someone else. So they're really owning that material. That's something that they'll take with them far beyond school and into their career as well. So student group work in which there is a learning activity which has a specific purpose, I do enjoy doing in class, and students really enjoy the involvement of working with other students from different disciplines. The other part that I bring in is storytelling. And what I mean by that is I will bring in patients and people who actually have to live with a disability, a disorder, a disease, an injury every day of their life. For example, here Jenny and Mike are explaining what it's like to have a spinal cord injury and how they deal with it and what they've been through, how physical therapy has helped them. their journey that they've gone on. And the PTA students will not only be able to interact with them, but they will also be able to see how they move in and out of a wheelchair and be able to actually practice some skills with patients. So I enjoy bringing the patient's voice into my classes. And whether you're in my face-to-face or my online classes, I will always have the patient's voice. If you're in my online classes, these are videotaped and I will put them inside our course for you to watch because they are very motivational and they are very good at helping the students connect the content to a person and to be able to understand empathy and how that works. We will also do events in the community. This is an example of we're playing gang ball, so these are paraplegic and we're playing gang ball with them. It's kind of like a basketball with wheelchairs, and it's fun and it's a lot of work, and it also gives us an idea of what it takes to do sports from a wheelchair. I also do individual assignments, not busy work, but work that you can practice and gain feedback from me, and also get a new way of looking or a new perspective of looking at the material. One of the great opportunities that I've had at Whatcom in the last few years is co-teaching. I've been able to co-teach with some amazing teachers. Here in this example, you'll see Patty and I are teaching together, the PTA students, a transferring technique. The students are gaining two different perspectives, two different instructors. We're appealing to different learning styles in the classroom. We're demonstrating. Students have really enjoyed having two instructors in the classroom, the ability to have two experts in different areas work together to help you understand the material. Well, thank you for listening to this video, and I look forward to getting to know each one of you on the first day of school, whether it's in my face-to-face or my online classes.